I want to share one of my favorite strategies for working on terminal knee extension after surgery, like total knee replacement or ACL reconstruction. So for clients who have access to a bench, this is a knee wrap. It's an elastic knee wrap, often used by people who are doing squats to support the knee. What we're going to do is we're going to place the surgical knee up on the bench. We're going to straighten the leg, and we're going to wrap the elastic strap above the patella. So we're not on the incision. We're not even actually on the knee joint itself. We're above the knee joint. You can do this. You can hold or sustain this position for 3 to 5 minutes, maybe even longer. Some clients will prefer the compression to be placed below the knee incision. So you could either go above the knee, you can go below the knee. In both cases, if the extension is too aggressive, you loosen up the elastic band. You can also activate the hamstring by actively curling the knee. When you see my knee rise, what's happening is I'm flexing the knee intentionally. I'm activating the hamstring. Now, the third version of this, you can go above the knee, you can go below the knee, or you can split the resistance, put part of it below, part of it above. My favorite is splitting the resistance, and you do not want to compress the kneecap, so that's why you can see I've got one wrap below, one wrap above. The nice thing about these knee braces is the Velcro allows any client to control or adjust the resistance. You simply pull off the Velcro, and immediately you can release the tightness. So this would be performed 3 to 5 times a day, 3 to 5 minutes per episode. It should be at the level of discomfort, but it should not be painful. Once you hit the level of pain, your body is going to automatically resist the extension. When you finish, you roll up the elastic wrap, place it on a shelf, and have it ready for next time. Do you have any way at home that what do you do at home to work on extension? Like laying on your stomach? Okay. And that's not bad. I like this a little better, and there's different ways you can do it. But basically what we're going to do is we're going to use this strap. I think we might have done this early on. Yeah. So you're still, if I do a quick measurement, conservatively 8 degrees shy of full extension. So this will be the last thing we do today. But basically what we're going to do, we'll come in here. I want comfortable pressure, not so much that you feel like you have to fight it, but enough that you feel like, okay, it's pulling down. Now, this will be your release. You can just pull on that and it'll let it go. I'm gonna just tuck it right there. What does it feel like right now? Tolerable? Yeah. Okay. So what we do is we're going to use the clock. We'll just hang out in this position for about 5 minutes. It's more aggressive than laying on the bed on your stomach, but we're not doing it as long. So normally when you're laying on your stomach, it's like 10 minutes, upwards of 20 minutes. This is going to be 5 minutes. And what you're going to do for me is every minute or so, you're going to give me about 10 repetitions where you tighten the hamstring underneath and you intentionally bend the knee a little bit. So do it for me, just like that, and then relax. And then do it again. So you're going to give me 10 reps, just like that, where you bend it, relax it. This is a version of what we call contract relax, where basically you're tightening the opposite muscle and then relaxing it to let it move into the direction that we want. There's 2 things that are limiting range of motion. One is the connective tissue, right? The ligaments, the connective tissue, the scar tissue, the fascia, all that stuff. The other part is the nervous system. Like your brain is saying, hey, we're not comfortable going straight yet. We need to protect this a little bit. So what we're doing here with those contractions are we're kind of waking up the brain to say, look, it's okay, you can relax. You don't have to be as restrictive, as guarded. Nothing's going to rip or damage or tear. And then with the 5 minutes, the long duration, we're taking that connective tissue, and it's called creep. We're basically stretching it over time. When you stretch for 30 seconds, you're really just stretching muscle and kind of stimulating the nerve. When you stretch for 5 minutes, 10 minutes, 20 minutes, now you're getting into that connective tissue that really just doesn't like to stretch. You know, it's like stretching a rope. So let's do another round. Perfect. Now, if you were going to try and do something like this at home, usually what we do is you sit in a chair, like a kitchen chair. You put the same chair on the other side facing you. So you're resting your heel on that chair, you're sitting on one chair, and then you would drape something that was kind of heavy over the knee. You know, you could also, so like, sometimes what we'll do is we'll use a belt, like a regular fashion belt. You put a belt over the knee and then you hang like a dumbbell in the belt. So it's pulling down kind of in the same manner.
So, to control that, hold the weight. So go ahead and wrap your fingers or hands around it. Now when you sit, control that. There you go.
Let's go again. What I'll do is after this one, I'm going to take another measurement. All right. I mean, it's definitely like better. I can barely get my fingers through without touching. Right here. Conservatively, now that's 3, where it was 8 before. What does it feel like right now? Okay, let's do one more exercise that I want you to try and do at home. Okay, so stand right there. Okay, so this is just a regular playground ball. It could be a pillow at home folded over. It could be whatever you have that's relatively soft and compliant. So what you're going to do is you're going to bring that toe right up underneath there. We're going to put the ball, I like above the kneecap. And then basically all you're going to do is you're going to lean forward, allowing that to press back. This foot can come up forward. Keep coming, keep coming. There you go. And so all you're doing is you're leaning into it, let that knee kind of be pressed back, and then you lean back away from it, not to the point where the ball falls, but where you feel that pressure come off. And then you lean into it again, and you come back. Keep doing that for me. Let's do about 10 of them. Hold each one a couple seconds.